on any given day, you could come across a victim of cardiac arrest, where your actions and training can determine the outcome. Today we'll review the key elements of providing basic life support to adults, children, and infants. This will include both CPR skills and AED use, as well as how to help a victim who is choking, and a discussion of special considerations. High-quality CPR improves a victim's chances of survival. There are several critical elements of high-quality CPR you should remember. Start compressions within 10 seconds of recognition of cardiac arrest. Push hard, push fast. Provide compressions at a rate of at least 100 compressions per minute and at a depth of at least 2 inches or 5 centimeters for adults. Allow complete chest recoil after each compression. Minimize interruptions. Try to limit interruptions in compressions to less than 10 seconds. Give effective breaths that make the chest rise. Avoid excessive ventilation.
There's no pulse. 1, 2, 3.
CPR begins with compressions. Because compressions are so important to a victim's survival, they need to be started immediately, within 10 seconds of recognition of cardiac arrest. Early CPR keeps the oxygen and blood flowing to the heart and brain, creating valuable life-saving time until spontaneous circulation is restored.
1, 2, 3.
To be most effective, CPR should be performed as a team with rescuers completing many tasks simultaneously. However, in order to be an effective team member, you need to master the individual skills of one rescuer CPR.
Let's switch now.
For this training, we will isolate the individual skills rescuers perform and then put them together, so you'll be prepared to deliver high-quality CPR and use an AED as a team. Right now, let's take a look at a textbook demonstration of 2 rescuer adult BLS.
Coming through, stand back please. Scene is safe.
The first step of BLS is assessment and scene safety. The first rescuer who arrives at the side of the victim must quickly be sure that the scene is safe. The rescuer should then assess the victim for a response and breathing.
Hey, are you okay? Can you hear me? He isn't responding. Isn't breathing normally, just gasping. Grab the AED.
If the rescuer is alone, he or she would then call for help and get the AED. The next step is to check for a pulse. To perform a pulse check in the adult, feel for a carotid pulse.
No pulse.
This technique is usually easier to perform on the side near the rescuer. Locate the trachea using 2 or 3 fingers. Slide these fingers into the groove between the trachea and the muscles at the side of the neck, where you can feel the carotid pulse. Perform the pulse check for at least 5 seconds and no more than 10 seconds.
2, 3.
If you do not definitely feel a pulse, immediately begin CPR, starting with chest compressions, CAB sequence. You already know how to give compressions. Now it's time to practice them. Right now we're going to pause the video to allow you to get into position to practice with the mannequins and learn the skills of CPR. For some healthcare providers and other rescuers, a 2-person or team rescue is far more common. In 2-rescuer CPR, each rescuer has a specific role. Rescuer 1 should be positioned at the victim's side. It is Rescuer 1's role to perform chest compressions, counting out loud.
1, 2, 3, 4.
You have already learned the proper technique for compressions.
9, 10.
Rescuer 2 should be positioned at the victim's head. It is Rescuer 2's role to maintain an open airway and give breaths with a bag mask while watching for chest rise and avoiding excessive ventilation. Rescuer 2 should also encourage Rescuer 1 to perform chest compressions that are fast and deep enough and to allow complete chest recoil between compressions.
7, 8.
Remember, push hard and fast, at least 2 inches or 5 centimeters. His chest needs to fully recoil between compressions.
5, 26, 27, 20.
As you are aware by now, giving good compressions can be very tiring. So in a two-person rescue scenario, it's important to switch roles about every 2 minutes to prevent fatigue. Every time the AED tells you to reanalyze, switch roles. If there is no AED present, switch roles after every 5 cycles of CPR. Now you know how to perform two-person rescue. But let's review some key points. The first rescuer performs chest compressions and counts out loud. The second rescuer maintains the open airway and gives breaths. The compression rate for two-rescuer CPR is at least 100 compressions per minute. The compression-ventilation ratio for adults is 30:2. Compression should be paused when giving breaths until an advanced airway is in place. When performing CPR without an AED, rescuers switch roles about every 5 cycles to prevent fatigue. When an AED is present, switch roles every time the AED tells you to reanalyze. This switch should take less than 5 seconds, minimizing hands-off time. The rescuer giving breaths must monitor the chest compressions that are being delivered, encourage the compressing rescuer to push at an adequate rate and depth, and allow complete chest recoil after each compression. Now we're going to pause the video to allow you to ask questions and prepare for the next section of the course, defibrillation. In a two-rescuer scenario, the bag mask system is the most common method used by healthcare providers to deliver rescue breaths and rescue breathing. A bag mask device consists of a ventilation bag and a face mask. It can be used with or without an oxygen source, and it comes in a variety of sizes. If you're using supplementary oxygen with the bag mask, the delivery method is exactly the same as without supplementary oxygen. Deliver each breath over 1 second, making sure you do not deliver the breath too quickly or forcefully. This will help reduce the chance of gastric inflation, air going into the victim's stomach instead of his or her lungs. If too much air enters the stomach, it can cause vomiting and potentially aspiration. Proper use of a bag mask requires instruction and practice. Just watch as Tony demonstrates the proper techniques. You'll have a chance to practice these skills in a few minutes. First, position yourself directly above the victim's head. You will use the E-C clamp technique to hold the mask in place. To do this, place the mask on the victim's face, using the bridge of the nose as a guide. Use the thumb and index finger of one hand to make a C to press the edges of the mask to the face. The remaining 3 fingers of your hand should form an E to tilt the head back, lift the angle of the jaw, and open the airway. Make sure you squeeze the mask with your thumb and index finger while lifting the jaw to achieve an airtight seal between the mask and the face. Squeeze the bag with your other hand or push it against your leg or body. If the chest doesn't rise with each breath, then you are not providing adequate breaths. If this occurs, readjust the mask, reposition the head and neck, and attempt to ventilate. If necessary, administer a larger amount of air. With or without supplementary oxygen, give 2 breaths after every set of 30 compressions. Right now we're going to pause the video to allow you to get into position to practice with the mannequins and learn the skills of opening the airway and giving breaths with a bag mask. Okay, now that you're in position, let's begin. Follow along with the video footage as you practice and switch students on the mannequins when the video instructs you to. We'll practice 5 sets of 2 breaths along with the video. Are you ready? Here we go. Give 2 breaths. Watch for chest rise. Give 2 breaths. Give 2 breaths. Give 2 breaths. Give 2 breaths. Now you're going to learn how to work as part of a team. For some healthcare providers and other rescuers, a two-person or team rescue is far more common. In two-rescuer CPR, each rescuer has a specific role. Rescuer 1 should be positioned at the victim's side. It is Rescuer 1's role to perform chest compressions, counting out loud.
1, 2, 3, 4.
You have already learned the proper technique for compressions.
9, 10.
Rescuer 2 should be positioned at the victim's head. It is Rescuer 2's role to maintain an open airway and give breaths with a bag mask while watching for chest rise and avoiding excessive ventilation. Rescuer 2 should also encourage Rescuer 1 to perform chest compressions that are fast and deep enough and to allow complete chest recoil between compressions.
7, 8.
Remember, push hard and fast, at least 2 inches or 5 centimeters. His chest needs to fully recoil between compressions.
5, 26, 27, 28.
As you are aware by now, giving good compressions can be very tiring. So in a two-person rescue scenario, it's important to switch roles about every 2 minutes to prevent fatigue. Every time the AED tells you to reanalyze, switch roles. If there is no AED present, switch roles after every 5 cycles of CPR. Now you know how to perform two-person rescue. But let's review some key points. The first rescuer performs chest compressions and counts out loud. The second rescuer maintains the open airway and gives breaths. The compression rate for two-rescuer CPR is at least 100 compressions per minute. The compression-ventilation ratio for adults is 30:2. Compression should be paused when giving breaths until an advanced airway is in place. When performing CPR without an AED, rescuers switch roles about every 5 cycles to prevent fatigue. When an AED is present, switch roles every time the AED tells you to reanalyze. This switch should take less than 5 seconds, minimizing hands-off time. The rescuer giving breaths must monitor the chest compressions that are being delivered, encourage the compressing rescuer to push at an adequate rate and depth, and allow complete chest recoil after each compression. Now we're going to pause the video to allow you to ask questions and prepare for the next section of the course, defibrillation.
There's no pulse. 1, 2, 3, 4, 5,
Remember,
6,
push hard and fast,
9,
at least
10,
2 inches or 5
12,
centimeters.
13, 14,
His chest
15,
needs to
16,
completely
17,
recoil
18,
after each
19,
compression.
21, 22, 23, 24, 25, 26, 27, 28.
Analyzing
Everybody clear?
heart rhythm. Do not touch the patient.
Although AEDs may differ slightly, there are 4 universal steps for operating an AED. First, turn on the AED. Open the carrying case or the top of the AED, then turn the power on. Some devices will power on automatically when you open the lid. The AED will guide you, but it's still critically important that you know these steps. Some AEDs may have adult and pediatric pads. Make sure you use the adult pads on anyone 8 years of age and older. Peel away the backing from the pads. Following the pictures found on the pads, attach the adhesive pads to the victim's bare chest. Place one pad to the side of the left nipple. Place the other pad on the victim's upper right chest directly below the collarbone. If instructed by the AED, clear the victim and analyze the rhythm.
11, 12.
Analyzing heart rhythm. Do not touch the
Analyzing.
patient.
Let's switch.
Shock needed. Charging. Stay clear of patient. Press the
Shock
flashing
advised.
button
Clear.
now.
Be sure that no one is touching the victim, not even the person in charge of giving breaths. Ideally, you will pause CPR during or immediately after a set of compressions. Some AEDs will tell you to push a button to allow the AED to analyze the heart rhythm. Others will do that automatically. The AED may take about 5 to 15 seconds to analyze the rhythm. The AED then tells you if a shock is needed. If the AED recommends a shock, it will tell you to clear the victim and push the shock button. Again, be sure no one is touching the victim to avoid injury to rescuers. Then loudly state a clear the victim message. It can be something like, "Everybody's clear," or simply, "Clear." Perform a visual check to ensure that no one is in contact with the victim.
Shock advised, clear.
Press the shock button. The shock may produce a sudden contraction of the victim's muscles. As soon as the AED gives the shock, immediately resume CPR, beginning with chest compressions. Do not remove the AED or turn it off. The AED will repeat the analyze and shock cycle every 2 minutes.
No shock needed.
When the AED indicates no shock advised, you do not check the pulse first, you immediately start chest compressions again. There are also some special situations you'll need to consider when using an AED. If a victim has hair on his chest, the hair may prevent the pads from sticking. The AED may tell you to check the pads. If this happens, press the pads down more firmly. If they still aren't sticking, rip the pads off forcefully, removing the chest hair. Then reapply a new set of pads to the bare skin. If your AED supply kit has a razor, you can use this to shave the area as well, and then reapply a new set of pads. Water on the victim's chest could allow the shock to travel through the water between the pads and prevent delivery of an effective shock dose to the victim's heart. If someone is lying in water, you should quickly move the victim to a dry area. If the victim is lying on snow or in a small puddle, you may use the AED. If the chest is covered with water or sweat, wipe the chest before attaching the AED pads. But wipe the chest quickly, as it doesn't have to be completely dry. Some people have implanted pacemakers and/or defibrillators in the same place where you would put the AED pads. The device will look like a round or square lump, smaller than a deck of cards. If you see this lump, try to avoid putting the pad directly over the lump. Do not place the pad directly over a medicine patch. If the shock delivery will not be delayed, take the patch off and quickly wipe the chest before you put on the pad. So we've covered a lot so far. Recognition of cardiac arrest, compressions, breathing, and defibrillation. Now let's put it all together in real time, just like we did before. Your instructor will put you in teams. After you've completed the practice session, you will switch roles and practice again. Right now we're going to pause the video so your instructor can explain how to operate the training AED you're going to use today and allow you to familiarize yourself with it. Now that you have familiarized yourself with the AED trainers you are using today, let's take one more look at the entire sequence of 2 rescuer adult BLS. Just watch now. You'll have a chance to practice momentarily.
Let us through. Everybody step back, please. Scene is safe. We can take it from here, sir.
Well, you guys got here quick.
Hey, can you hear me? Are you okay? He's not responding. He's not breathing normally, just gasping. Grab the AED. There's no pulse. 1, 2, 3, 4, 5,
Remember,
6,
push hard
7,
and fast.
9,
At least
10,
2 inches or
11,
5
12,
centimeters.
13, 14,
His chest
15,
needs to
16,
completely
17,
recoil after
18,
each
19,
compression.
21, 22, 23, 24, 25, 26, 27, 28.
Analyzing
Everybody clear?
heart rhythm. Do not touch the patient.
Let's switch now.
Shock needed. Charging. Stay clear.
AED
of
says shock
patient.
advised. Everybody
Press
clear?
the flashing button now. Shock delivered. Begin CPR.
1, 2,
Start
3,
with
4,
compressions.
5, 6, 7, 28, 21, 22, 23,
Analyzing
24,
heart rhythm.
25,
Stay
26,
clear
27,
of
28.
patient.
Let's switch again.
Shock needed. Stay clear of patient. Charging. Press the
Everybody
flashing
clear?
button now. Shock delivered. Begin
1,
CPR.
2, 3,
Start
4,
with
5,
compressions.
6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 20, 21, 22, 23, 24, 25,
Analyzing
26,
heart
27.
rhythm. Stay clear of patient.
Everybody clear? Let's switch.
No shock needed.
He's breathing, and it's normal. There's a pulse.
Let's get ready to transport.
Right now, we're going to pause the video to allow you to get into position to practice the full sequence of two rescuer adult. If the victim had been a child.
Hey, Donnie, are you okay?
There are important differences between BLS for children and BLS for adults. Under the American Heart Association BLS guidelines, anyone from the age of 1 to puberty is considered a child. For these BLS guidelines, puberty is defined as chest or underarm hair on males and any breast development on females. When performing compressions on a child, use one or two hands, whichever allows you to provide deep, effective compressions. Compress to a depth of at least 1/3 the depth of the chest, about 2 inches or 5 centimeters, allowing the chest to recoil completely. If you are unable to compress to the correct depth with one hand, either due to fatigue or lack of upper body strength, use two hands to provide ongoing high-quality compressions. For a single rescuer for victims of all ages, use a compression to ventilation ratio of 30 compressions to 2 breaths. If you are in a 2 rescuer team for children, the ratio should be 15 compressions to 2 breaths. Delivery of breaths to children requires less volume and force, but you still need to use enough air to see the chest rise. There are some differences in when to activate the emergency response system. If you did not witness the arrest and are alone, you should perform 5 cycles of CPR before you leave the child to activate the emergency response system. If the arrest is sudden and witnessed, leave the child, activate the emergency response system, get the AED or defibrillator, then return to the child. As you can see, there aren't a lot of differences between adult and child CPR, but they are important ones. Right now, we're going to pause the video to allow you to get into position to practice child compressions. Remember, when performing compressions on a child, use one or two hands, whichever allows you to provide deep, effective compressions. Now that you're in position, let's begin. Follow along with the video footage as you practice, and switch students on the mannequins when the video instructs you to. Are you ready? Here we go.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
Now we're going to pause the video to allow you to ask questions and prepare for the next section of the course, Infant BLS.
Baby, baby. Greg, I think we got a problem here. Greg, she's not breathing. Activate emergency response.
Got it.
One, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
Help's on the way. Let's start 15 and 2. Great chest rise. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. 1, 2, 3, 4, 5, 8, 9, 10, 11, 12, 13, 14, 15. Let's switch.
Any emergency can seem scarier when an infant is involved. However, the principles of performing CPR on infants less than a year old are the same as they are for adults and older children, with a few significant differences. To begin, let's take things in the same order as we did for adult CPR. We're going to teach you the skills you will need for 1- and 2-person infant rescue. First, check the victim for a response and breathing. If the infant is unresponsive and not breathing or only gasping, send someone to activate the emergency response system and get the AED. Check the infant's brachial pulse. Place 2 or 3 fingers on the inside of the upper arm, between the infant's elbow and shoulder. Press the index and middle fingers gently on the inside of the upper arm for at least 5 seconds and no more than 10 seconds when attempting to feel the pulse. If there is no pulse, or if the heart rate is less than 60 per minute with signs of poor perfusion, make sure the infant has adequate oxygenation and ventilation. If he or she does, begin CPR. Place the tips of your 2 fingers in the center of the infant's chest, just below the nipple line. Do not press on the bottom of the breastbone. Push hard and fast, to a depth of at least 1/3 the depth of the chest, or approximately 1.5 inches or 4 centimeters, at a rate of at least 100 compressions per minute. After each compression, completely release the pressure on the breastbone and chest, allowing the chest to recoil completely. Count out loud as you give compressions. Give 30 compressions in a row.
26, 27, 28, 29.
Now let's take a look at using a bag mask device to provide rescue breaths for infants. Make sure you have the right size mask so it isn't too big. Remember, chest rise is the most observable sign to determine the effectiveness of your rescue breaths. First, position yourself directly above the infant's head. Place the mask on the victim's face using the bridge of the nose as a guide. Use the thumb and index finger of one hand to make a C to press around the edges of the mask. The remaining fingers of your hand should form an E to lift the angle of the jaw and open the airway. Make sure you hold the mask against the face with your thumb and index finger while using the remaining fingers of that hand to lift the jaw and open the airway. Make sure you make a tight seal between the mask and the infant's face. Squeeze the bag with your other hand to deliver just enough breath to make the chest rise. Deliver each breath over 1 second. If the chest doesn't rise, then you are not providing adequate breaths. Adjust the mask, reposition the head and neck, or administer a larger amount of air. We've talked about the differences in compressions and breaths for children and infants, but now let's cover the difference in the use of an AED for an infant or child under 8 years of age. Some AEDs have been modified to deliver different shock doses, 1 shock dose for adults and 1 for children under 8. If you use a pediatric-capable AED, there are features that allow it to deliver the child-appropriate shock. Which feature is available depends on the type of AED you are using. If your AED includes a smaller size pad designed for children, use it. If not, use the standard pads, making sure they do not touch or overlap. The important thing is to be familiar with the AED you will be using, if possible, before you actually need to use it. When you are using an AED, remember to turn it on first and follow the prompts as it leads you through the rest of the steps. For infants, a manual defibrillator is preferred to an AED for defibrillation. If a manual defibrillator is not available, an AED equipped with a pediatric dose attenuator is preferred. If neither is available, you may use an AED without a pediatric dose attenuator. For ventilation with advanced airway, compress at a rate of at least 100 compressions per minute without pauses for breaths. Give 1 breath every 6 to 8 seconds, or 8 to 10 breaths per minute. You've learned a lot so far. But another thing you should know is what to do if a victim has a pulse but is not breathing effectively. When an adult, child, or infant has a pulse but is not breathing effectively, rescuers should give breaths without chest compressions. This is rescue breathing. For adults, give 1 breath every 5 to 6 seconds, about 10 to 12 breaths per minute. For infants and children, give 1 breath every 3 to 5 seconds, about 12 to 20 breaths per minute. Give each breath in 1 second. Each breath should result in visible chest rise. And you should check the pulse about every 2 minutes. Because many cardiac arrests happen at home, you may need to give breaths to a family member or close friend when you are off duty. To give mouth-to-mouth breaths to a victim 1 year of age and older, hold the victim's airway open with the head tilt chin lift. Pinch the nose closed with your thumb and index finger. Take a regular breath and seal your lips around the victim's mouth, creating an airtight seal. Give 1 breath, blowing for about 1 second. Watch for the chest to rise as you give the breath. If the chest does not rise, repeat the head tilt chin lift. Give a second breath. If you are unable to ventilate the victim after 2 attempts, promptly return to chest compressions. So now you know how to perform BLS for an adult, child, or infant. As we said at the beginning of the class, on any given day, you could come across a victim of cardiac arrest, where your actions and training can determine the outcome.
Oh, hey, Scott.
Hey, Sam. How you doing?
I'm looking forward to a few days of not being on call.
I didn't think you ever needed rest.
Oh, I'm not resting. I've got my whole family coming into town this weekend, and they're expecting me to provide the entertainment. What's wrong?
I think he's choking. Are you choking? I'm going to help you. Sit down. Sit down.
Choking occurs when food or other items block a person's airway. In severe airway obstructions, the victim usually will have signs of poor air exchange and breathing difficulty, such as a silent cough, cyanosis or turning blue, and an inability to speak or breathe. The adult or older child may clutch the neck with both hands, making the universal choking sign. This is a signal to ask if the victim is choking. If the victim nods that he or she is choking and cannot talk, you must act. In a standing or kneeling victim, you'll perform an abdominal thrust often referred to as the Heimlich maneuver. Stand or kneel behind the victim and place your arms around the victim's waist. With one hand, locate the navel. Then make a fist with the other hand. Place the thumb side of your fist against the victim's abdomen, just above the navel and below the breastbone. Grasp your fist with your other hand and press your fist into the victim's abdomen with a quick, forceful upward thrust. Repeat thrusts until the object is expelled from the airway or the victim becomes unresponsive. If the victim is too large for you to wrap your arms around the waist, pregnant or overweight, for example, wrap your arms around the victim's chest and do chest thrusts instead of abdominal thrusts. If your attempts to relieve choking in an adult or child are unsuccessful or the victim becomes unresponsive, send someone to activate the emergency response system. Perform CPR using the CAB sequence with one exception. Each time you open the airway to give breaths, look for the obstructing object in the back of the throat. If you see an object that can be easily removed, carefully remove it, but do not perform a blind finger sweep as the object may become lodged further back in the airway. Choking is also a fairly common emergency among infants. The steps to relieving choking in an infant are quite different than those for older children and adults. If you find an infant choking and they are responsive, first sit or kneel with the infant in your lap. Hold the infant face down with the head slightly lower than the chest, resting on your forearm. Support the head and jaw with your hand. Avoid compressing the soft tissues of the infant's throat. Rest your forearm on your thigh to provide support. Deliver up to 5 back slaps forcefully between the infant's shoulder blades using the heel of your hand. Deliver each slap with sufficient force to attempt to remove the foreign body. Then place your free hand on the infant's back, supporting the head with the palm of your hand. This will cradle the infant between your 2 forearms as you turn the infant over while carefully supporting the head and neck. Keep the infant's head lower than the chest and deliver up to 5 quick downward chest thrusts the same way you perform compressions, just below the nipple line, over the lower half of the breastbone. Do this at a rate of about 1 per second. Repeat the sequence of 5 back slaps and 5 chest thrusts until the object is removed or the infant becomes unresponsive. Right now we're going to pause the video to allow you to get into position to practice with the mannequins. Now that you're in position, let's begin. Follow along with the video footage as you practice, and switch students on the mannequins when the video instructs you to. Are you ready? Here we go. As with an adult, if a choking infant becomes unresponsive, shout for help. Then lay the infant on a hard, flat surface. Perform CPR with one exception. Each time you open the airway to give breaths, look for the obstructing object in the back of the throat. Chest compressions may help move the object so you can remove it. Once you can see the object, carefully try to remove it. Never perform a blind finger sweep. You only want to sweep for an object if you can see it. If you are alone, after about 2 minutes or 5 cycles of CPR, activate the emergency response system. So you've learned the proper BLS rescue techniques of CPR, rescue breathing, and treatment of choking, and know how to react in a 1 or 2 person rescue situation. Now you get to show how well you've learned. Your instructor will evaluate each of you.